signs and symptoms of deterioration, we first need to recognize that this might be different in different groups of persons. So let's take, for example, a diabetic patient who has tested positive for COVID-19. These patients might experience very high blood glucose levels, which is definitely an indication for seeking medical attention, or they may experience very low blood glucose levels, which is another indication where they would need to dial 811 and seek emergency attention. For patients who have high blood pressure, same thing goes. If their blood pressures go sky high, they may need to be presenting to an emergency department or seeking assistance through GMRTT. As Dr. Richards Abdul said, worsening breathlessness or shortness of breath, worsening fatigue, new onset chest pain, heart racing or increased pulse, these are all warning symptoms. And if they are persistent, new or worsening, then we would advise that you seek medical attention. Patients who present or who family members who notice their relative is having a lower level of responsiveness, meaning they are not as arousable or as awake as they were before, these patients require emergency care. Many patients have pulse oximeters at home to test their pulse and their oxygen levels. And if you are not experiencing worsening shortness of breath, but you notice that your oxygen level at home is falling, let's say it's usually 95 and today you've noticed it dip to 92, 89, then that is an indication to seek emergency care. If you notice that your loved one is not tolerating food or drink, not eating, having excessive vomiting or diarrhea, and they are unable to take in feeds or drink, then these patients are at risk of dehydration. They can develop kidney failure, and those patients also need medical attention. So there's no one symptom or sign, but it might be different in different groups of patients. Just note that in kids, these patients might present with irritability, lack of feeding, crying, and whereas in the elderly population, they may present with less responsiveness, lack of feeding, lack of arousability. So I would just like you to appreciate that if you are caring for a loved one with COVID-19, or you yourself or your family member has COVID-19 and you are experiencing worsening of these symptoms, worsening of blood pressure, pulse, blood glucose levels, falling oxygen levels, new onset chest pain, or any of these symptoms or signs we've discussed, it is important to get yourself emergency medical attention, as presenting earlier can affect the course and your prognosis of COVID-19.